Question number 361. The nurse is caring for the post-myocardial infarction client in an intensive care unit. So it is noticed that urinary output has dropped from 60 to 70 ml per hour to 30 ml per hour. So this change is most likely due to option A, dehydration, option B, diminished blood volume, option C, decreased cardiac output, and option D, renal failure. So option C, decreased cardiac output is correct answer, because cardiac output and urinary output are directly correlated with each other. So the nurse should suspect a drop in cardiac output if the urinary output drops. Question number 362. A depressed client who has recently been acting suicidal is now more social and anesthetic than usual. So he tells the nurse, I have made some discussion about my life. So what should be the nurse's initial response? Option A, you have made some decision. Option B, are you thinking about healing yourself? Option C, I'm so glad to hear that you have made some discussion. Option D, you need to discuss your decision with your therapist. So option B, are you thinking about killing yourself is correct answer, because sudden mood elevation and energy may signal increased risk of suicide. So the nurse must validate the ideation as a beginning step in evaluating the seriousness of the risk. Question number 363. A client developed the volume overload from an IV that has infused too rapidly. So what assessment would the nurse expect to find? Option A, S3 heart sound. Option B, thready pulse. Option C, flattened neck vein. Option D, hypoventilation. So option A, S3 heart sound is correct answer, because auscultation of an S3 heart sound, this is an early sign of the volume overload, because during the first phase of diastole, when the blood enters the ventricle, an extra sound is produced due to the pressure of the fluid left in ventricles. Question number 364. When an autistic client begins to eat with her hands, and the nurse can best handle the problem by option A, placing the spoon in the client hand and stating, use the spoon to eat your food. Option B, commenting, I believe you know better than to eat with your hand. Option C, well, I guess sometime work better than spoon. Option D, removing the food and stating you can't have any more food until you see the spoon. So option A, placing the spoon in the client hand and stating use the spoon to eat your food is correct answer, because this response identify adapted behavior with instruction with verbal expression. Question number 365. A client has been receiving the lithium for the past 2 weeks for the treatment of bipolar illness, and when planning the client teaching, so what is the most important to emphasize to the client? Option A, maintain a low sodium diet. Option B, take a diuretic with lithium. Option C, come in for evaluation for serum lithium level energy for 1 to 3 months. And option D, have blood lithium level drawn during the summer month. So option D, have blood lithium level drawn during the summer month is correct answer, because client taking the lithium therapy need to aware that the hot weather may cause the excessive perspiration and the loss of sodium, and consequently an increase in serum lithium concentration level. Question number 366. Clients taking which of the following drugs are at the risk for depression? Option A, steroids. Option B, diuretics. Option C, folic acid. Option D, aspirin. So option A, steroid is correct answer, because adverse medication effects can cause a syndrome that may or may not remit when the medication is discontinued. Question number 367. The primary nursing diagnosis for a client with congestive heart failure with pulmonary edema is option A, pain. Option B, impaired gas exchange. Option C, cardiac output altered or decreased. And option D, fluid volume excess. So option C, cardiac output altered decrease is correct answer, because all nursing intervention should be focused on improving the cardiac output. So increasing cardiac output is the primary goal of the therapy, and comfort will improve as the client improve, and the respiratory status will improve as cardiac output increases. Question number 368. The nurse caring for a 14-year-old boy with the severe hemophilia A who was admitted after a fall while he was playing basketball. So in understanding his behavior and planning care of this client, so what must the nurse understand about adolescent with hemophilia? So option A, must have structured activity. Option B, often take part in active sports. Option C, explain limitation to peer groups. And option D, avoid risk after bleeding episode. So option B, often take part in active sport is correct answer, because in hemophilia should be aware that contact sports may trigger the bleeding. Question number 369, a newborn admitted to the NICU with tracheoesophageal fistula. So which of the following nursing intervention should be included here? So option A, elevated the head for feeding. Option B, elevating the head but keep the child NPO. Option C, insert a nasogastric tube for feeding. And option D, encourage the mother to feed. So option B, elevating the head but keep the child nil per oral is correct answer. Question number 370, in providing care to a 14-year-old adolescent with the scoliosis. So which of the following will be the most difficult for this client? Option A, compliance with treatment regime. Option B, looking different from their peer. And option C, lacking independence in the activities. And option D, reliance on family for their social support. So option B, looking different from their peer is correct answer, since many person view any disability as deviant and the client will need help in learning how to deal with the reaction of others. Question number 371, the nurse is assessing a client with delayed wound healing. So which of the following risk factor is most important in this situation? Option A, glucose level of 120. Option B, history of myocardial infarction. Option C, long-term steroid uses. And option D, diet high in carbohydrates. So option C, long-term steroid usage is correct answer, because steroid dependency stands to delay the wound healing. Question number 372, which of the following nursing assessment indicate the immediate discontinuation of an antipsychotic medication? Option A, involuntary rhythmic stereotype movement and tongue protrusion. Option B, check puffing and involuntary movement of extremity and tongue. Option C, agitation, constant state of motion. And option D, hyperpyrexia, severe muscle rigidity and malignant hypertension. So option D, hyperpyrexia, severe muscle rigidity, malignant hypertension is correct answer, because these are the sign of neoplastic malignant syndrome. Question number 373, in order to enhance the client response to medication for chest pain from the acute angina, the nurse should emphasize option A, learning relaxation techniques. Option B, limiting alcohol use. Option C, eating the smaller meals. And option D, avoiding the passive smoke. So option A, learning relaxation technique is correct answer, because anxiety can be a great enough to make the pain medication totally ineffective. So we can reduce the anxiety through relaxation therapies. Question number 374, which complication of cardiac catheterization should the nurse monitor for in the initial 24 hours after the procedure? Option A, angina at rest. Option B, thrombus formation. Option C, dizziness. And option D, falling blood pressure. So option B, thrombus formation is correct answer, because thrombus formation in the coronary artery is a potential problem in the initial 24 hours after the cardiac catheterization. A falling blood pressure occur along with hemorrhage of the insertion site, so which is associated with the first 12 hours after the procedure. Question number 375, a client has been newly diagnosed with hypothyroidism and will take the levothyroxine 50 microgram per day by mouth. So as part of the teaching plan, the nurse emphasizes that this medication, option A, should be taken in the morning. Option B, may decrease the client energy level. Option C, must be stored in the dark container. And option D, will decrease the client heart rate. So option A, should be taken in the morning is correct answer, because it should be taken in the morning, which can minimize the side effect of medicine. Question number 376, when teaching a client with coronary artery disease about nutrition, so the nurse should emphasize option A, eating the 3 balanced meal a day. Option B, adding complex carbohydrates. Option C, avoiding very heavy meal. And option D, limiting sodium to 7 gram per day. So option C, avoiding very heavy meal is correct answer, because eating large heavy meal can pull blood away from the heart for digestion and is dangerous for the client with the coronary heart disease. Question number 377, the nurse is performing a neurological assessment on a client post-right CVA, which finding, if absorbed by the nurse, and would warrant the immediate attention. Option A, decrease in level of consciousness. Option B, loss of bladder control. Option C, altered sensation to stimuli, and option D, emotional lability. So option A, decrease in level of consciousness is correct answer, because decrease in level of consciousness showed a further decrease in level of consciousness would be indicated of further progression of the CVA. Question number 378. While planning care for a toddler, the nurse teaches the parents about the expected developmental changes for this age. So which statement by the mother shows that she understands the child developmental needs? So option A, I want to protect my child from any falls. Option B, I will set limit on exploring the house. Option C, I understand the need to use those new skills. And option D, I intend to keep control over the child. So option C, I understand the need to use those new skills are correct answer, because Erickson described the stage of the toddler as being the time when there is normally increase in autonomy. So the child needs to use the motor skill to explore the environment. Question number 379. A client has a Swan gas catheter in place and the nurse understands that this is intended to measure option A, right heart function, option B, left heart function, option C, renal tubule function, and option D, carotid artery function. So option B, left heart function is correct answer, because Swan gas catheter is placed in the pulmonary artery to obtain the information about the left side of the heart. For the right side of the heart, we are using CBP. Question number 380. A nurse enters a client room to discover that client has no pulse or respiration. So after calling for the help, the first action the nurse should take place. First, option A, start a peripheral IV. Option B, initiate the closed chest massage. Option C, establish an airway, and option D, obtain the crash cart. So option C, establish an airway is correct answer, because establish an airway is always the primary objective in a cardiopulmonary arrest. Thank you.